Good morning, everybody. Ethan Gladwell here with Medicare Millennials, where we're teaching you folks how to sell Medicare all year long. All right. Well, we know today is October 1st, so this is day one of AEP for 2020. Pretty exciting. I wanted to get something out to you guys before all this starts. A couple of folks had reached out to me and asked, what do you bring in the house? Or, of course, if you're doing it over the phone, you need to have some of the same things here. But what do you do while in the house, and what do you bring? Okay, well, I'm just going to break that down. I'm going to try and dummy it a little bit. I want to make sure to make this super simple, and I don't want this video to go on forever. So a couple of things that I bring in, which I'll show you, and then I'll kind of discuss and break down why I bring this and kind of how it is that I introduce this into the conversation. First things first, when I get into a house and I've built a little bit of rapport and we're sitting down at the table having a good time, the first thing I have is this, okay? And what this is what I call my little about me. This is what I hand the client, okay? And I say, well, Mrs. Jones, before I get started going into any of this, let me explain who it is that I am and what it is exactly that I do, okay? So on this sheet, it says the things that I can handle: Medicare, final expense, prescription drugs, just anything and everything, okay? Everything that I take care of. Then below here, I have the affiliated companies. Now, obviously, we want to put the top guys on here, okay? If you're working a county or an area that doesn't even have, one of these companies, Humana, Cigna, whatever it may be, you may not have that on there. But for us, in the areas that we work, this is all the big time insurance companies that we work with. What I want them to do is I want them to see the company that they have. Let's say they have United Healthcare. Great. Well, Mrs. Jones, as you can see, I work with United Healthcare. I'm a representative with them, okay? So I'm familiar with the plan that you have, and I can make sure to answer any questions that you have. So that's the first thing I do, okay? After I go over my bridge, my introduction to my bridge, the next thing that I have is a needs assessment or a fact finder. Mine's pretty basic. I don't need all that information that a lot of folks do get, because all I'm in there to do today is sell Medicare. Later on, I can go back in and ask other questions, other products, etc. All it is name, date of birth, age, tobacco use, address, phone number, email. If these people make their own household decisions, their health, their Medicare number, Medicaid, if applicable, company. A super important question I ask every single person is how they got that current coverage that they have, okay? Whether it been over the phone, personal agent, or if they just simply can't remember. When was the last time they had a policy review? 1 year, 1 to 3 years, 4 to 5 years, their primary doc, their specialist, their income, and their prescription drugs. And that's it. Pretty basic. Once I get all that information and we're starting to decide that there is an opportunity, or once that I have decided there's an opportunity to help this person out, then, before we go any further and I start discussing, this ought to look familiar. Of course, every carrier's got one. This is just a generic one, and this is a scope of appointment. This is something that I have the client sign. Before we ever get into any sort of details. Super important. Again, you can go with the carrier you're going with. They all have their own particular specific scope of appointment, but I always get this signed, okay? Even if I do the carrier scope of appointment, I want this. You're going to learn that I am a big CYA guy, okay? Medicare is heavily compliant, and I want to make sure that I'm covering everything, including myself, okay? Then what I get is I have this right here. I have this right here. Let me go into this one first. All this is it, again, has the primary doctor, the primary doctor's location, if they're a current patient of the primary doc, any specialists, the medications, the dosages, and frequencies. And I have, after we fill that entire thing out, I have the client sign here saying, based on everything here, this looks good. The reason I do this is the biggest CYA. Okay, the reason I do this is because I don't want to sit there and write everything down or not write anything down, put this person into a particular plan. I get a phone call January 1 saying they went to the pharmacist, and by the way, my insulin's not covered. What do I do? Well, Mrs. Jones, you didn't tell me about that insulin. So again, that's, we got to figure something out because you got to have the insulin. This just covers you. Saying, Mrs. Jones, I asked you, and we in fact wrote it all down, and you had a signature here saying you checked off that that's all your drugs, okay? Now that doesn't solve the issue, and you need to do that, but what it does do is it protects you from any sort of complaints or anything like that that the client can do. Final thing that I use is just a little comparison chart, okay? These people are what I have branded or tokened as pen and paper people, okay? You can talk till you're blue in the face and it's going to sound good, yada yada. The second you walk out that door, they're going to go, what the hell did he just say? It happens every time. Been doing this 5 years, so I've realized you need to write it down. So instead of writing it on a napkin or a janky piece of paper, just come up with something that looks like this. And it says your current coverage, your new coverage, okay? This is what they can reference when you leave. This is if you get a phone call saying, Ethan, I don't know, what did we do again? Mrs. Jones, take a look at that comparison that I have, okay? All it says is premium, primary care doc, copay, specialist doc, copay, preventative, inpatient, outpatient, emergency, urgent care, max out of pocket, and then what your drug cost will be per year. That's it. When that person sees that, go, Mrs. Jones, reference that sheet that I left you there. Okay, see how you're currently paying $10 a month for your premium? Well, now it's $0. See how your primary is $10? Well, now it's $0, yada yada. It's just going to remind them and refresh their memory on why they have done what they did, okay? Again, guys, I am huge on CYA. I have been doing this for a while now, have had 0 complaints. I've had some folks call me and say, well, blah, 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 isn't covered. Well, Mrs. Jones, again, I'll fix it for you. But again, if we'll take a look here, you didn't mention that you were on insulin or you didn't mention that drug. So at the end of the day, it's not my fault. I couldn't do anything for you on that. But I'll make it right, okay? So again, guys, this isn't a cop-out. This isn't anything other than to protect you as the agent. We know these folks are forgetful. They're seniors, okay? They may not remember a drug that they are currently taking or anything like that. So just do what you can to cover yourself, protect yourself. Make sure, of course, the client's taken care of, but this is going to take care of you, okay? If you have any questions, you need to see, what we're doing or what we have here, what we've used that works. As always, feel free to reach out. Maybe you're doing something that I haven't even thought of before. That's a possibility. Look at the color of the hair here. I don't think about a whole lot going on up there. So, anywho, if there's something out there that you know of or that you see, please reach out. Let us know. I want to know about it. If there's something that I could use that would streamline this, let's go for it. So, as always, guys, happy AEP. Let's get started. If you don't have big goals here, if you're not going to write at least 100 plans, then you need to find somebody and talk to them because that's the goal, 100 plus plans. Let's get to it. Reach out if you have any questions, and we'll talk soon. Take care.